Let's discuss the Chinese and Western medical thought, its history and issues. The core theory and concepts in TCM were developed when very little was understood about human anatomy and physiology. Unlike Greece and Rome in antiquity, ancient China forbade dissections as the human body was considered sacred. Ancient Chinese descriptions of the organs in the human body and substances contained therein were therefore simplistic and often conjectural. However, the theory built around these entities became more complex in order to explain observable physiological phenomena, diagnose illnesses, prescribe therapies, and contend with complications of changing symptoms as illnesses progress. Essentially, TCM theory consists of a number of idealized models within which entities and concepts and their mutual relationships are presented in a manner that renders them applicable to the diagnosis and treatment of illnesses. The TCM picture of the human body is highly simplified. Besides skin, bone, and connective tissue, the body comprises organs, 3 basic fluids, which are qi, blood, and injure, and the pathways, namely meridians or channels, and along which qi and other entities can travel. The healthy body is one in which there is internal balance and normal flow of fluids and energy. Illness is expressed as a condition or conditions under which these flows are impeded and or a number of entities are not in balance. Such pathological conditions are known in TCM as syndromes. Syndromes in TCM have some similarity to syndromes in Western medicine in that they comprise a number of typical or defining symptoms, forming a distinct clinical picture indicative of a particular underlying disorder. The underlying disorder is presumed in Western medicine to be attributed to microorganisms like virus, bacteria, and fungi. Unusual cellular behavior, a dysfunctional immune system, abnormal endocrinal secretions, and the like, or a combination of this. For example, the irritable bowel syndrome, or IBS, is exhibited as a recurrent dyspepsia, abdominal pain, and irregular bowel movement, the cause of which is unknown. The treatment is largely one of providing symptomatic relief. In TCM, the syndrome of weak spleen and stomach chi exhibits similar symptoms to that of IBS. The treatment addresses the underlying imbalance by providing a tonic for chi and promoting its flow. The basic causes of illnesses are classified into external pathogenic and internal pathogenic factors. External factors comprise mainly climatic influences, which include heat, cold, dampness, dryness, wind, and summer fire that can invade the body. Internal factors comprise harmful emotions and improper living habits. External and internal pathogenic factors upset balance and interrupt both flows in the body, causing illness. TCM models can thus be seen as attempts to explain the pathological conditions underlying illnesses. Diagnosis and therapy then consist of identifying these pathological conditions and finding matching therapies for them. This approach is knowing differentiating the syndrome and applying appropriate therapy known as Bianjing-Lunji. The core approach of TCM treatment of illness is thus basically directed at reestablishing balance and unimpeded flows, rather than at eliminating germs or correcting abnormal cell behavior of cells, as is the case of modern biomedicine. In a nutshell, TCM treatment is directed at resolving syndromes rather than overcoming disease. the raison d'etre being that eliminating the symptom takes away the basis for the continuation of the disease. Thank you for listening.
Let's discuss interviewing, this time the disease history. We must ascertain how and when a disorder arose to get an idea about its etiology, which will help us to reveal which patterns of imbalance can have initiated the disorder and which imbalances can have arisen as a consequence of it. We must ask the patient how long they've had the symptoms and whether the symptoms appeared suddenly or slowly over a period of time. A disease or symptom that develops slowly and gradually usually occurs due to a deficiency condition. An exception to this is blood deficiency. Blood deficiency can arise when there is heavy bleeding, such as there is in childbirth, for example. An excess condition will often result in symptoms that appear suddenly or over a shorter period of time. This therefore means that acute conditions are usually excess in nature. Chronic disorders will almost always be pure deficiency conditions, or more commonly, combined deficiency and excess conditions. A condition that starts as a deficiency condition can easily develop an excess aspect. For example, liver yin deficiency can also begin to manifest with ascending liver yang, while spleen deficiency will often result in dampness, to name just two very common examples. Conversely, an excess condition can easily develop into a deficiency and deficiency excess condition. Extreme heat, such as in a febrile illness, can injure yin. Blood stagnation can result in heavy menstrual bleeding, which then leads to blood deficiency. Inquiring about how the symptoms themselves have developed and how they have changed will also give you an idea of the nature of the disorder. Symptoms that rapidly change are usually more yang excess in nature, whereas yin deficiency symptoms tend to develop more slowly. Inquiry should also be made into the circumstances surrounding the onset of symptoms. How was their life at that time, and were there any changes in their life in this period? Had they started taking a new medication? Did they have a febrile illness? Were there any significant climatic influences? Was there crisis in their relationship or a change of employment? Or had they made dietary or other changes in this period? The answers to these questions will give an idea of the etiology of the disorder. If we know what the etiology is, we will then have a good idea of the imbalances that may be present. The patient's medical history is also relevant. What disorders have they suffered from over the years? Knowing this will give an indication of whether there is a particular pattern and whether the current situation could be a part of this pattern. A severe febrile illness could have weakened their yin or qi, or it could have generated phlegm. A gastrointestinal ailment that they picked up in India 10 years ago could help to explain the presence of damp heat in the lower jaw and spleen qi deficiency. It is vital that the patient is asked about what makes their symptoms better or worse and when the symptoms occur. This requires the memorizing of which etiological factors can create which patterns of imbalance. The following examples are presented to give an idea of this way of thinking and are far from comprehensive. A condition that is adversely affected by dietary factors is usually a stomach-spleen imbalance, but it could also indicate the presence of phlegm, damp heat, cold, yang deficiency, or yin deficiency. If the disorder is affected by climatic influences, then one or more of the 6 forms of exogenous pathogenic factor will be involved. It can, though, also indicate a lung disorder, weight deficiency, or the presence of internally generated Damp-Phlegm. If the symptoms are provoked by activity, then it is probably often a blood deficiency condition, while an excess condition usually improves with activity. This, though, is just a rough rule of thumb. A deficiency condition can, for example, result in a stagnation, in which case the patient may well feel amelioration immediately after activity, but the symptoms or the general condition will usually feel worse later on in the day or the day after. The reason for this is that the physical activity will help to circulate qi, but will at the same time consume their qi and blood, so the condition will deteriorate in the long term. Conversely, blood stagnation can manifest with a strong, sharp pain when a joint is activated or extended beyond a limited range of movement, but will be less painful when the joint is at rest. Stress can create stagnation of liver qi, generate heat in the body, and injure yin. This means that symptoms that are exacerbated by stress can be manifestations of these patterns. Emotional influences that provoke or exacerbate a disorder will indicate an imbalance in the organ that relates to these emotions. Certain symptoms arise at specific times during the day. Symptoms that come later in the day or in the evening can be a sign of a deficiency condition. If they come in the evening or at night, it will often be yin deficiency. Symptoms that are related to certain hours of the day can also be interpreted through the Chinese horary clock and whether an organ or channel is at its peak or ebb during this period. Blood stagnation symptoms are often worse or manifest at night when blood is not being circulated by physical movement and activity. This is typically seen in joint pain and traumatic injuries. Symptoms that are worse in the premenstrual period are often related to liver qi stagnation, and symptoms that are worse immediately after the menstrual bleeding are more typically seen when there is yin deficiency or blood deficiency. It is also important to determine whether there are other symptoms that arose concurrently with the symptoms or the disorder. As the more symptoms that relate to a certain organ, the more likely it is that this organ is directly or indirectly involved in the present imbalance. So to tabulate, we have here the symptoms and significance. Symptoms that have arisen gradually are usually a deficiency or a deficiency excess condition. Symptoms that have arisen suddenly, generally an excess condition, but can also be a deficiency condition. The symptoms that have changed rapidly, usually a young or excess condition. The symptoms have changed slowly and gradually, usually a yin deficiency or a deficiency excess condition. Thank you for your attention.
Let's now talk about the core principles of yin and yang. And for today, the interdependence of yin and yang. Yin and yang are opposite, but are also mutually dependent on each other. Yin and yang cannot exist in isolation, and this is very apparent when considering the body's physiology. All the physiological processes are a result of the opposition and interdependence of yin and yang. The functions of the internal organs in Chinese medicine show the interdependence of yin and yang very clearly. The yin and yang organs are very different in their functions, but at the same time, they depend on each other for the performance of these functions. The yin organs depend on the yang ones to produce qi and blood from the transformation of food. The yang organs depend on the yin ones for the nourishment deriving from blood and essence stored by the yin organs. Each organ has a structure represented by the organ itself and the blood and fluids within it. At the same time, each organ has a certain function which both affects and is affected by its structure. For example, the structure of the liver is represented by the actual organ and the blood stored within it. In particular, the liver has the function of storing blood. Another function of the liver is that of ensuring the smooth flow of qi all over the body. By ensuring the smooth flow of qi, the liver also keeps the blood moving, therefore providing a correct storage of blood within itself. This is an example of how the liver function assists the liver structure. On the other hand, in order to carry out its function, the liver organ itself needs the nourishment of blood. This is an example of how the liver structure assists the liver function. Without structure, which is yin, the function, which is yang, could not perform. Without function, the structure would lack transformation and movement. The simple questions in chapter 5 says, yin is in the interior and is the material foundation of yang. Yang is on the exterior and is the manifestation of yin. Neither yin nor yang can exist without the other. The existence of which requires the other as condition or precondition. Thus, without yin, there would be no yang, and without yang, there would be no yin. Without coldness, there would be no hotness, and without hotness, there would be no coldness. The classification canon by Zhang Jiping of the Ming Dynasty points out, yang is born of yin, and yin is born of yang. Again, an accompanied yin cannot be generated, and solitary yang cannot be formed. Spleen labels these two additional aspects in the interaction between yin and yang, the relationships of mutual dependence and of mutual support. They are applied extensively, that is, in physiology, pathology, and therapeutics. Consider, for example, the relationship between qi and blood in the human body. Note here that the term qi is used in a narrower sense. In the body, qi belongs to yang, whereas blood and essence belong to yin. Yet, qi can generate blood and can reside in blood. Qi can generate essence, and essence can generate qi. From this, it can be seen that in the human body, the principal manifestation of the mutual dependence and mutual support of yin and yang lies in their mutual assistance and augmentation. The yin and yang each has its own province of activities. Their actions are neither unrelated nor exclusive. Rather, they are cooperative and harmonious. It is, as plain question states, yin resides in the interior and is reserved for yang, and yang resides in the exterior and is the manifestation of yin. This is the best explanation for the physiological relationship of interdependence and mutual support between yin and yang in the human body. If the interdependence and mutual support of yin and yang are disrupted, both lose their condition for existence and pathological changes will ensue. Suppose, for example, that the relationship between yang qi and yin fluid in the body or between substance and function is disrupted. In mild cases, there may be disharmony between yin and yang, resulting in damage to yang qi or yin fluid. In severe cases, there may be disconnection between yin and yang, resulting in the exhaustion of essence and qi, and hence the end of vital activity. Thank you for listening.
Let's discuss the extraordinary young organs, the prostate, the sperm chamber. First, the man. Although the uterus is one of the 6 extraordinary young organs, there is a corresponding structure in men. It is said in Chinese medicine that the uterus is related to the kidneys. In males, it is called red field, dantian, or also room of essence. In females, it is called uterus. As mentioned above, the uterus was called shi bao. In Chinese medicine, bao is actually a structure that is common in both men and women, and which and which is in the lower field of elixir, the Danchen in men. Bao is the room of essence. The room of essence in men stores and produces sperm and is closely related to the kidneys and the governing vessel. If the kidneys and the governing vessel dumai are empty, the production and storage of sperm by the room of essence will be affected, and this may cause impotence, premature ejaculation, clear and watery sperm, nocturnal emission, spermatorrhea, etc. Obviously, while the uterus is an actual organ occupying the space of the lower field of elixir, the dantian, the room of essence, is not an actual organ or structure, as we know that sperm is made partly in the prostate and partly in the testicles. Although the prostate is not mentioned in ancient Chinese books, it could be postulated that the prostate is the male organ equivalent to the uterus in women. Thus, we can postulate that the three extraordinary vessels, directing, penetrating, and governing vessels, which in women originate from the space between the kidneys and flows downward through the uterus, in men flow through the prostate. In men, the prostate is the organ equivalent to the uterus in women. The sperm chamber is the reproductive organ unique to the male. Its physiological function is to produce and store sperm. The essence of medical classics states the uterus in female and the sperm chamber in the male. These are the places where blood and vital energy converge and where essential chi of yin and yang transforms into the fetus. This function of the sperm chamber derives from the kidney. In PCM, the domain of the kidney, which governs the reproductive capacity of the body, extends to include all the reproductive organs, including the testes. Hence, the testis is also known as the external kidney or the outward manifestation of the kidney. Thank you for your attention.
We continue with treatment principles. Now we'll discuss treating the root only. Generally speaking, treating the root only is sufficient to clear all clinical manifestations in most cases. The method of treating the root can be used in both interior or exterior, as well as chronic or acute diseases. Examples of this approach have been given in our past episodes. In case of spleen yang deficiency, the root causing the previously mentioned clinical manifestations, treating the root, that is, tonifying and warming the spleen, will be the correct approach, which in time should clear all the clinical manifestations. Similarly, for the clinical manifestations caused by wind cold or those caused by yin deficiency, in both these cases, it will be sufficient to treat the root, that is, expel wind cold in the former case and nourish yin in the latter, to clear all the clinical manifestations. Treating only the root in cases of original and deriving patterns is done only when the clinical manifestations reflect primarily the root or the original pattern, and the clinical manifestations of the manifestations are few and mild. For example, in case of spleen deficiency, giving rise to dampness, tonifying the spleen is enough to resolve dampness, only if the symptoms of dampness are very mild. In most cases, attention should be given to treating the manifestation as well, that is, resolving dampness. The approach of treating the root only is applicable in cases when the clinical manifestations are not too severe. If the clinical manifestations are severe or even life-threatening, the approach should be changed. So to summarize, in the case of original and deriving patterns, treating the root only is applicable when the clinical manifestations of the manifestation are few and mild. Thank you so much for listening.
Let's continue with diagnosis according to Zanko organ patterns. For today, we discussed Damp-Phlegm in the lung. Damp-Phlegm in the lung can occur when the chi mechanism of the lung is disrupted by repeated invasions of exogenous pathogenic chi or when a spleen is not able to separate the pure from impure, resulting in damp and phlegm arising in the middle jaw, which are then sent upwards along the pure good qi to the lungs. According to Chinese medicine, phlegm is created by the spleen and stored in the lung. This means that in chronic conditions where there is damp phlegm in the lung, the spleen must also be tonified at the same time. The presence of damp phlegm will block the spleen and lungs qi mechanism, and this blockage can lead to the further formation of phlegm dampness. Now let's discuss its etiology. Damp phlegm in the lung can arise from invasions of exogenous pathogenic qi that disrupt lung qi and block the transformation and spreading of fluids. As described above, the spleen qi deficiency and dampness are often at the root of an accumulation of damp phlegm in the lung. The spleen is particularly burdened when diet contains a lot of food that has a cold or damp energy, or when the food and liquids consumed are physically cold. The pattern can also arise through the use of medicines that are energetically cold. Posture can be a contributing factor. If the person has a tendency to sit stooped or slumped, it will block both the spleen and lung qi mechanisms. This will lead to the formation of damp phlegm in the middle jaw and the accumulation of damp phlegm in the upper jaw. Emotional factors such as sorrow or worry can affect the lung and spleen, and this may be a contributing factor to this pattern. What are its signs and symptoms? We have chronic cough with loose sputum, copious amounts of white sputum that is easy to expectorate. There will be chest oppression. There may be a sensation as if there is a heavy weight or a rock lying on the chest. There will be slight breathlessness, and the symptoms are worse in the supine position. There will be mucus or sputum in the throat, and the voice will be slightly gravelly or nasal. There will be wheezing, a dull pale complexion, and the flesh in the face may be slightly doughy, and the flesh in general may be doughy. There will be difficulty thinking clearly, and there will be tiredness and heaviness of the body. There will be nausea or poor appetite, and a swollen tongue with greasy coating and a floating and slippery pulse. The key symptoms here are cough with loose sputum. Sputum is clear or white in color, a greasy white tongue coating. For the treatment principle, we transform and drain dampness and phlegm and regulate lung qi. We can choose from these acupuncture points for treatment: lung 1, lung 5, lung 7, lung 9, REN 12, REN 17, REN 22, spleen 3, spleen 9, stomach 36, stomach 40, UB 13, and UB 20. For our needling technique, we tonify on lung 7, lung 9, spleen 3, stomach 36, UB 20, and REN 12. And then we use draining or even technique on the other points. Moxa is also applicable to spleen 3, stomach 36, and UB 20. For the explanation on the choice of acupuncture points: lung 1, lung 5, lung 9, UB 13, and REN 20 drain phlegm and regulate lung qi. Lung 7 and REN 17 regulate lung qi. REN 12, UB 20, spleen 3, and stomach 36 tonifies spleen qi, transform damp and phlegm. Spleen 9 drains damp, and stomach 40 drains phlegm and opens the chest. Another relevant advice: It is essential that a person with damp phlegm in the lung avoids consuming damp and phlegm-creating foods and beverages, especially dairy products, sweets, wheat, sugar, bananas, avocados, dried fruit, and so on. They should also avoid consuming cold refrigerated foods, foods that have not been cooked, and eating regularly, as this will strain the spleen and can lead to the formation of dampness and phlegm. Correct body posture and exercise are important in order to avoid stagnation and blockage of chi mechanism in the upper and middle jaw. Repeated invasions of exogenous pathogenic chi can be a contributing factor in the formation of dampness and phlegm in the lung. This means that the patient must make sure that they are suitably dressed and do not expose themselves to invasion of exogenous pathogenic chi. Beating the chest and the upper back with a loose fist or a wooden spoon will help activate chi in the chest and thereby help to resolve stagnations of phlegm and dampness. Damp and phlegm in the lung can be caused by the following patterns of imbalance: lung chi deficiency, spleen yang deficiency, kidney yang deficiency, and invasions of exogenous pathogenic chi in the lung. In turn, damp phlegm in the lung can result to the following patterns of imbalance: phlegm heat in the lung chi deficiency, and spleen chi deficiency. So to summarize, phlegm dump obstructing the lung has its etiology in an invasion of exterior cold poorly expelled, overexertion and poor diet over a long period, excessive consumption of greasy, cold, raw foods, leading to phlegm dump production by spleen settling in lung, and chronic spleen lung yang deficiency. Its signs and symptoms are cough with easy expectoration of watery white sputum, aggravated by exposure to cold, aggravated by physical movement, and there is feeling of cold hands, phlegm on the throat, a dizziness, a feeling of fullness and oppression in the chest, and feeling of cold in the chest. The pulse will be slippery and slow, and the tongue will be swollen and wet with a sticky white coating. The treatment principle: we transform phlegm damp, regulate the water race, descend lung chi, and suppress cough. So our acupuncture treatment will we can choose the following points from the following points: lung 5 to clear phlegm from lungs. Ren 7, this supplements lung chi. Bladder 13 supplements lung chi. Ren 22 diffuses lung and transforms phlegm. Li4 releases the exterior. Pericardium 6 loosens the chest and rectifies chi. Lung 7 descends lung chi. Ren 12, it resolves phlegm. Bladder 20 supplements the spleen and resolves phlegm. The spleen 3 supports the spleen. Lung 9 supplements lung yin, and stomach 36 transforms damp. All these are needled with every method. Thank you for your attention.
Let's discuss the diagnosis according to 8 principles, the hot and cold imbalances. In the principal pair of hot and cold, the imbalance is differentiated according to the imbalance's energetic nature. Heat is yang in nature. It overactivates and accelerates the body's processes. Cold is yin and will do the opposite. It will slow down or weaken processes, and because it has a contracting nature, it will create blockages of qi, blood, and yin. The precise symptoms will again depend on whether it is a deficient or excess condition, and whether it is an interior or exterior conditions. There are often situations in which there is both heat and cold present simultaneously. There may be, for example, heat and cold in different organs at the same time. There may be a heat in the upper part of the body and cold in the lower part. There can also be heat and cold in different aspects of the body. For example, wind cold in the exterior and heat in the interior. We have here a table of the difference between heat and cold conditions. For the heat, there is overactivates and accelerates the body processes. With cold, it weakens the body and makes processes slower. For heat, it expands, while in cold, contracts and creates stagnations and blockage. In heat, it desiccates and concentrates the body's fluid. For the cold, disrupts the transformation and transportation of the body's fluid. In heat, there is changes in the color of the skin to red and exudations to yellow or green. For the cold, white or bluish skin color. For the heat, it causes exudation and discharges to become odorous, thicker, and stickier. For the cold, there is exudation and discharges that do not smell. It is clear, watery, and more copious discharges from the body's orifices. For the heat, there is throbbing, stinging, or burning pain, while in cold, there is biting or cramping pain. For the heat, it is a red tongue, while in cold, it is pale tongue. For heat, it is yellowish tongue coating, excess condition, or no tongue coating, deficient condition. While in cold, it is a whitish tongue coating. For heat, there is a rapid pulse, while in cold, it is a slow pulse. In heat, there is a rapid movement, while in cold, slow and languorous movement, deficient conditions, stiff movement, excess condition. For the heat, there is restlessness, agitation. For cold, lethargy. For the heat, it sends chi upward, excess condition, or does not root chi, deficient condition. For the cold, blocks chi, excess condition, or does not move chi, deficient conditions. For the heat, there is thirst, while in cold, no thirst. For the heat, there is constipation with dry stool, while in cold, most frequently loose stool or diarrhea, but there can be constipation. The stools will not be dry. For the heat, there is insomnia, while in cold, possibly hypersomnia if there is deficient cold. For heat, sleep with limbs stretched outward and with increased movement of the body while sleeping, sleeps with thin blankets and may have a tendency to kick the bedding up while sleeping. While in cold, sleeps with body curled up with thick bedding, does not move about in the bed while sleeping. For the heat, the skin can feel warm on palpation. For the cold, the skin can feel cold on palpation. Thank you for your attention.
Okay. Let's talk about depression, the Lilium syndrome. Many modern Chinese books often discuss depression syndrome as if it were identical to the depressive phase of manic depression. Many Chinese books, therefore, when giving the symptoms of depression, give the symptoms of Tian. This is unhelpful and not corresponding to clinical practice. The depression in clinical depression is quite different from the depression in bipolar disorder or manic depression from both a Western and a Chinese perspective. From a Chinese perspective, the depressive and manic phases of bipolar disorder are two poles of a pathological spectrum with the same pathology. Central to the pathology is phlegm obstructing the mind. This accounts for both the depressive and the manic phases of the disease. Phlegm obstructs the mind, but also the ethereal soul, so that it interferes with its coming and going, resulting in depression when it does not come and go enough, and mania when it comes and goes too much. By contrast, in depression, phlegm is not always present, and the coming and going of the ethereal soul is always impaired without a manic phase, resulting in a depressed mood, lack of inspiration, lack of a sense of direction in life, lack of life dreams and plans. The Lilium syndrome is described in the Essential Prescriptions of the Golden Cabinet, Chapter 3-1. This syndrome sounds remarkably like the description of a depressed patient. It says, The patient wants to eat but is reluctant to swallow food and unwilling to speak. He or she wants to lie in bed but cannot lie quietly as he is restless. He wants to walk but is soon tired. Now and then, he or she may enjoy eating but cannot tolerate the smell of food. He feels cold or hot but without fever or chills, bitter taste or dark urine. That is, it is not external wind or internal heat. No drugs are able to cure this syndrome. After taking the medicine, the patient may vomit or have diarrhea. The disease haunts the patient, who means fox and wo means bewildered. And although he looks normal, he is suffering. The pulse is rapid. Modern books describe the syndrome with the following symptoms, as if in a trance or absent-minded: mental restlessness, bitter taste, dark urine, anxiety, depression, red tongue, which may be without coating, and rapid pulse. The treatment principle recommended by modern doctors is to moisten and nourish the heart and lungs, tonify qi, nourish yin, clear heat or empty heat, calm the mind, and strengthen the willpower. The points suggested by the book Chinese Acupuncture Therapy are as follows: heart 7, kidney 3, lung 9, heart 5, lung 7, kidney 4, spleen 6, heart 9, pericardium 9, kidney 7, bladder 15, bladder 13, bladder 23, lung 7, kidney 6, liver 3. So to summarize, Lilium syndrome or Pai He Ping, the patient wants to eat but is reluctant to swallow food, unwilling to speak. He or she wants to lie in bed but cannot lie quietly as he or she is restless. He or she wants to walk but is soon tired, cannot tolerate the smell of food. He or she feels cold or hot, rapid pulse. Thank you for your attention.